Okay, welcome everyone to our Niagara Pride Lunch and Learn. Niagara Pride is an independent 501c3 organization serving the LGBT plus individuals and families in Niagara County, New York. We do a number of community service events, backpack, clothing, food drives. We host educational programming such as this Lunch and Learn, health fairs, um, and we host different community events with Pride, and we're really just trying to create safe spaces for LGBTQ plus individuals to meet and socialize. So today's Lunch and Learn, we will have Mark from Heart, Love, and Soul, Jennifer from Horizon Health, Steve and Rachel from the Pride Center, and Anna from Blue Cross Blue Shield. And
I'm sorry, excuse me. Actually, Anna is at an event, so Crystal is going to take over for me and she's on as well. Thank you.
Okay, thanks, no problem, Crystal. All right, and we will be recording and sending out slides and handouts so people will have access after the event today. All right, let's go ahead and get started. Mark, you wanna start us off here?
Sure, and thanks for the invitation and the opportunity to talk a little bit about Heart and Soul. My name is Mark Beatsell. I'm the executive director here. I've been executive director for about 5 months. Our previous executive director, Sister Beth Rosemer, was here for over 10 years, and prior to her, another Franciscan sister was here for about 10 years. So Heart and Soul is not a Catholic agency. However, it's as close as you get with the tradition that we've had with the Franciscan sisters in leadership. Heart and Soul was founded in 1982 from a prayer group at the former Sacred Heart Church in Niagara Falls, which is now closed. But at that time, there was a group that started meeting together to pray together and recognized that some of its own members were struggling financially and having difficulties with food. So members of that group started bringing in canned goods, food items to share amongst the group. It became a very popular part of the ministry of Sacred Heart Parish, and soon the church did not have the room to store all the food that was coming in, and the members of the prayer group recognized that there was great need beyond simply the church and into the greater community. So in 1983, the group incorporated as a separate nonprofit called Heart, Love, and Soul. They had their original location at 1501 Pierce Avenue in the city of Niagara Falls, which is fairly close to the library. For the first 5 years or so, it was a food pantry, and then in the late 1980s, they began providing takeout meals as well, hot lunches that they prepared at their site at 1501 Pierce Avenue, and then distributed at off-site locations. That went on for about a decade until Heart and Soul moved to its current location, which is here at 939 Ontario Avenue in 2004. So Heart and Soul, as you know it now, or if you might know it now, sort of took shape in 2004 when we consolidated and had enough space to provide both the food pantry and in-house dining at one facility. In addition to the meal services, in 2004, we added a case manager and also a part-time nurse through a partnership with Mount St. Mary's Hospital in Lewiston. And that position, we call that our healthcare coordinator, has been with us since that time and is a great partnership to provide for some of the deeper needs of members of the community who come here for food support. In addition to our food pantry services, we have our hot lunch, which I already mentioned. We serve meals Monday through Friday between 11 and 1 p.m. Prior to COVID, we were serving just an hour a day. But because of the demand of COVID and also to keep things a little bit safer and space people out, we decided to do 11 until 1. During COVID, we had to shut down our dining operation. And to this day, we have not reopened for sit-down dining, but people are able to come into the building, take a meal, and then eat it off-site. We also have something we call the necessary shop, which is kind of a supplement to the food pantry. People can come in once a month and receive personal care items, personal hygiene items, cleaning supplies. Those are items that they're not able to get through their SNAP benefits. So that's a service that we provide. In addition to the food services, we have special events that we do throughout the year. We have a Thanksgiving and Christmas food giveaway. We have a foot clinic that we do in partnership with Mount St. Mary's Hospital, coordinated through our healthcare coordinator. And things like the Foot Care Clinic, Narcotics Anonymous, Veterans Day celebrations, healthy cooking classes, haircuts, Bible study, a number of things that unfortunately we've had to suspend right now because of COVID-19, but we're hoping that we'll be able to get back with those programs up and running in the months ahead as people become vaccinated. The big news at Heart and Soul this year is the opening of our Daybreak program. So Daybreak is a community one-stop. It's a community initiative. It's under the purview of Heart, Love, and Soul, but this was not a program that originated solely with Heart and Soul. So back in 2011, there was a coalition, the Niagara County Coalition for the Homeless, that came together to talk about issues that the community was experiencing, that they were experiencing as service providers, and wanted to come up with strategies and solutions for overcoming a lot of the difficulties that they were having and that people were experiencing in the community. Through Niagara University, the group was connected to DePaul USA, which is a national provider of services and advocacy to the homeless. And this group took on that name of the DePaul Task Force. It included Heart and Soul, Community Missions, Catholic Charities, YWCA of Greater Niagara, and a number of other providers. And after years of discussion and trying to analyze the problem, they decided that a one-stop center would help ease some of the struggles that people were facing. So Niagara Falls has a lot of different service providers. However, the group was seeing that a lot of people were not getting access to those services because of lots of barriers, poverty, unemployment, transportation, all those things that were preventing them from really accessing and engaging those services. And the idea was that a one-stop center that was centrally located to house multiple services would help people overcome some of those barriers and facilitate access, and also improve communication between providers. Often an individual would go to one agency, get referred to another, but there wasn't that warm handoff, and people would fall through the cracks. So we're hoping, and we've studied this issue a lot, and we've had a lot of collaboration from other partners that this program, this facility, and the services that it offers will help meet some of those needs and really help change the service delivery landscape in Niagara Falls. In addition, this year we also started providing more direct housing referrals. Heart and Soul is now the lead coordinated entry agency for people experiencing homelessness. So we can do assessments. People who are deemed most vulnerable are then referred first and lined up for housing and services first. We also have a new street outreach program that just started this year. Last week we got a car, so we're going to be out in the community, going to places where homeless people congregate, trying to connect them to services at Heart and Soul or to other members of other partner agencies within the continuum of care. Also at Daybreak, I forgot to mention that we have showers and laundry and a computer lab, and we have rotating offices for different partner agencies to come in and deliver their services on site. Right now, we have about 30 different partner agencies who have signed up. However, we haven't been able to roll that out like we wanted to because of COVID-19, but we're working now with our different partner agencies to start planning for them to come in to use that space. And in the meantime, clients can come here to Heart and Soul into Daybreak and connect with their providers remotely. So it's an interesting program. There's been a few kinks here and there along the road in the first 3 months of implementing, but in general, it's going well. It's been well received by the community, and we're hoping it's really going to make a difference here in Niagara Falls. That's about all I have. Thank you.
Awesome. Thank you so much. We'll hold questions to the end just so we can get through everybody. So thank you again, Mark. Next up, we have Jennifer from Horizon.
Thank you. Thanks. So my name is Jen Lochran. My pronouns are she, her, hers. I am currently the first coordinator of diversity, equity, inclusion, and belonging at Horizon. I initially started off as a stud counselor back in 2010. I was there for a couple of years. I then left Buffalo, moved to Las Vegas, and primarily worked with children and adolescents in an acute and residential setting. And then just in 2018, I moved back to Buffalo and went back to Horizon. I was a clinical trainer for a while. And then, like I said, I just am currently in the transition of this new role. I can do the next slide. So for those of you who are not familiar with us, Horizon is a not-for-profit corporation that provides treatment for substance use and or mental health disorders. Horizon is comprised of Horizon Health Services, which is mainly our outpatient services, Horizon Village, which is our stabilization and residential programs, and HMG, which is more of our administration buildings. Next slide. Our mission, just really wanted to focus on that, together for recovery, changing lives and saving lives. Next slide, please. So Horizon offers several different services, including outpatient stabilization and rehabilitation services, and support services for patients, their families, and loved ones. Next. When it comes to our outpatient locations, we are located in Erie, Niagara, and Genesee counties. We provide individual, group, and family counseling for mental health and substance use disorders. We also have private counseling if necessary, and that's located out of our 55 Dodge location in Gettysville. We also have medication-assisted treatment and recovery coaching, and we also provide continuing care and support services, including things like job skills, vocational skills, home health care, and other case management. Next. So our Terrace House location, which is located at 291 Elm Street, Terrace House provides medically supervised detox and stabilization services. Most often after completing our detox services, our patients will transition to our stabilization services, and that's really based on individual need. Next. For our residential treatment, so we have Horizon Village is our campus located in Sanborn, and we have several different houses on campus. So we have Horizon Village, which is a 50-bed male-only residential substance use treatment program. Our Freedom Village provides intensive substance use treatment to men who have served in the military and or our first responders, which incorporates specialized services for those who may have also been diagnosed with PTSD or other mental health disorders. Our Delta Village is an inpatient rehab for our young adults. And then Aurora Village is a 25-bed residential treatment facility for women with substance use disorders as well. The Wellness Center offers more medical, psychiatric, and recreational services to all the campus patients there. Next. So we started offering telehealth services prior to COVID, but once that happened, we ramped up training so that all of our staff could be trained on telehealth, and we were able to offer telehealth services due to its high needs. So it's still our primary way of working with our patients currently, but we are slowly adjusting back to having patients on site, but still they always have the option of either telehealth or telephonic sessions. So just a few other, had to incorporate the dogs. We have a few other services that we provide. There's parent and family support services. So we have a parent and family support coordinator who specializes in presentations for our schools and other organizations. They typically focus on the opioid overdose prevention and Narcan training. They talk about our therapy dog program and also the awareness on the dangers of alcohol and substance use disorders, including prescription drug use and dependency. Our care coordination team, they work together with members to make sure all needs are being met. They will assess for needs, link with resources in the community, coordinate with other providers, and they help to continue to manage those needs and meet the goals of the individuals. Our recovery coaching, a few more back. Recovery coaching is a form of strength-based supports for persons in or seeking recovery. It's a type of partnership where the person in treatment, it's self-directed, while our recovery coach provides expertise and additional support. And then, of course, our therapy dog program. Our therapy dogs are trained to provide affection and comfort to patients. They fulfill an emotional void that is often drained by substance use and or mental health disorders. A majority of our therapy dogs are located around the campuses. We always make sure that it's safe for the patients, that they're comfortable with it, with them being around. If they are going to a location where patients aren't familiar with them, we always send out a memo and let our staff know to make sure that our patients are aware that they're coming. We love when they are around because they're just so nice to be around, having them there for the staff as well as for the patients. Thanks. Next. And then we also understand that some of the populations we serve require more unique and specialized treatment. So we offer women's services, which focuses more on maternal mental health and infertility struggles. Our veterans and first responders, as I mentioned, we have Freedom Village. Most of our outpatient clinics work with adolescents, but we also have a specialized program at our Hurdle location, which is an outpatient one, and they treat children as young as 3 years old. And we work very closely with the families or the guardians, whoever is working with the children. And then we also serve the LGBTQ plus community and provide additional training to staff. We did offer a substance use treatment group specific for our LGBTQ plus patients, but it's currently being revamped. As always, we want to make sure that we're providing the most up-to-date and evidence-based treatment. So currently working on that. The treatment that we provide focuses not only on treatment for substance use and mental health disorders when working with this population, but we also focus on some of the contributing factors that might lead to these issues. So including prejudice, discrimination, stigma, social and economic marginalization, any kind of increased exposure to violence and bullying, and also lack of family and peer support. So for any of our clinicians who want to have more of a specialty training in this, we also assist with that, and we provide internal training for our staff. Just a little bit more about Horizon. So we have about over 700 employees. When I was here in 2010, we were only at 300, so definitely has expanded. And then you can go to the next slide. And then if just for our admissions team, if anyone is looking, calling our admissions team with any questions, even if it's not about a program that we can offer, we will always assist with getting someone to the right place. Thank you.
Awesome. Thank you so much. Yeah. All right. Next up, we have Steve or Rachel from the Pride Center.
Thanks, Justin. My name is Steve Jaggard. I'm a program manager with the Pride Center of Western New York. I use he, him pronouns, and I'm here to talk a little bit about some of the programs and services that the Pride Center provides for the community. Our organization is a nonprofit based in the city of Buffalo. We're located on Delaware between Tupper and Chippewa Streets. The purpose of the Pride Center is to provide programs and services that improve the overall health and well-being of LGBTQ plus community members. So I'm going to talk a little bit about some of the things that I work on, and then Rachel and Gideon are going to talk about some of the programs that they conduct. So with regard to LGBTQ plus older adults, we have a few different programs that serve their needs. We know that isolation disproportionately impacts senior citizens, and when you add LGBTQ plus identity into that, the isolation can be increased for varying reasons. If you layer a pandemic on top of everything, we know that isolation has definitely been a big issue lately. So our Silver Pride Project is a social organization that tries to provide different opportunities for LGBTQ plus seniors to network, make friends, find connections. And we currently are doing programming virtually on Zoom on Saturdays at noon. It's called our Silver Pride Coffee Hour. We're in the planning stages of trying to get some in-person stuff back off the ground right now. So some of the senior centers within the community are reopening their doors to in-person activities, and we're talking about doing things here at the Pride Center in the coming weeks. We also have our Caregiver Support Initiative program, which is geared towards caregivers of loved ones that are somewhere on the memory loss spectrum, Alzheimer's or dementia disease. So if you are a caregiver of a loved one with memory loss, we want to link you with resources and supports in the community that are going to help you on your caregiving journey. If you are in need of respite care, or if you need education courses or home safety assessments, those types of things. We can also provide different supports. We work on joint enrichment activities, which essentially are different things in the community that caregivers and care recipients can participate in together. And through those activities, they'll interact with other people going through similar experiences. So it's kind of like a surrogate support group. We have other different social programs too at the Pride Center. We have our Pride Lit Club, which features different books that are LGBTQ plus authored or protagonists in the content of the books. So we do that monthly on third Thursdays on Zoom right now. We offer other programs that improve health, like smoking cessation. We are currently working with our Pride Chess Club that we just launched, that we're trying to revamp and get some different other type of gaming opportunities, other things for people to network socially. Trying to think. I know there's a million things that are just not coming to the top of my head right now, but
Yoga.
What was that, Rachel?
Yoga.
Yoga, health and wellness again. So we offer free yoga on Mondays at 5 o'clock in partnership with Yogis in Service. That again is on Zoom right now, but it will be coming back into the Pride Center in the coming weeks. So with that, I'm going to turn it over to Rachel and let her talk way more eloquently than I do about the things that she does. So thank you.
Yeah, thank you. Hi, everybody. My name is Rachel. I use she, her pronouns. I'm our engagement and education specialist. And so the predominant time that I spend at the center is not working with LGBTQ plus people per se, but those that might be serving them. And that's through our LGBTQ plus cultural competency program. Basically what that is a training that we can provide to literally anyone that requests, from schools to law enforcement to healthcare facilities, to help them learn more about this community and also gain some tools to be better serving their clients or community members that are coming through, and also coworkers, because we're everywhere. Also knowing too that sometimes it's not like a full formal training that folks need, but just a time to chat with some folks here at the center and get some new eyes on forms or policies or documents, and we can fulfill that as well. So giving some recommendations, getting up-to-date language, that kind of thing. Also, in addition to training, I also facilitate our group that is geared towards the women in our community. So any queer women or those who understand that space is centered for them are welcome to our Women of Pride group. That right now is meeting virtually on Zoom on the second Tuesday of the month. Don't worry, this is all on the website calendar. And basically every single month we come up with like a new activity, something fun, bring in some guest speakers, talk about things that are relevant to the women in our community. We've done like fun things like a yoga class, or we just brought in someone to paint with us, to more serious conversations around sexual health. We did a whole talk about personal lubricant. You know, you missed out. But knowing that anyone can come and really participate in this and really benefit from that sense of community. Same thing with like the seniors, but with this group, it can be any age, which if you want to go hang out with the seniors though, they're really awesome folks. So please go to coffee hour. So I think I'm catching everything that I do. So I'm going to hand it over to Gideon to talk more about some of the sexual health programming we do.
Right. Hi, everyone. My name is Gideon. I'm a community health specialist here at the Pride Center. So I actually work with the young men who have sex with men and people of trans experience populations that come into the center. Just some of the things that we provide confidential and rapid in-person HIV testing. If someone's not comfortable coming into the center to get an HIV test, we can deliver take-home rapid HIV tests that is a mouth swab that they can do at home. We provide safer sex kits, which include condoms, lube, vaginal condoms, dental dams, etc. We also provide sexual health programming for people of trans experience and for young men who have sex with men. This includes a presentation that we can offer that we can go to different places and do, or we could do it on Zoom. Currently, we're collaborating with Evergreen Health Services. I'm co-facilitating a chemsex support group that's on the second and fourth Monday of each month, and that is also on Zoom. So I actually kind of wanted to let you know that, Jennifer, because you said that yours isn't happening right now. So if you ever want to reach out, or if you have gay or bi men that are looking for like a social support group that have engaged in chemsex, that would be appropriate for them. So we also have a social support group for people of trans experience called Transgeneration, and that meets on the first Tuesday and third Monday of the month. That is also currently on Zoom. And we have a new trans coming out support group that's called Under Construction, and that starts next month, and that's for people of trans experience who are early in their transition or newly coming out. But we wanted to support them as well. And just some other things that we do here at the center. We link a lot of people in our community to affirming providers, including primary specialty care, gender affirming providers and services, mental health and substance use, housing, and then we also do linkages to STI testing. We also have the capacity to help people of trans experience with legal name and gender marker changes. And I think we about covered it all. Thank you.
Awesome. Thank you so much. Lots going on. All right. And last up, we have Crystal from Blue Cross and Blue Shield.
Hi, everyone. Good afternoon and happy Friday to all. I'm Crystal Butera from Blue Cross Blue Shield of Western New York. We have our Buffalo office at 257 Genesee Street. Due to COVID, of course, along with everybody else, we've talked about a lot of Zoom meetings and such. Everything that we do now is over the phone, and perfect example what we're doing now with Zoom. So what my position is with Blue Cross Blue Shield is a facilitated enroller. Now, of course, all the speakers have talked about health and wellness, mental health issues, STIs, and of course, all of that comes into play. You have to have health insurance to get services more than likely at different, places for services as far as billing goes. So that's where we come in. Blue Cross Blue Shield of Western New York has been around for over 75 years. We are nationwide, which is a lot different than a lot of other health plans out there. And of course, due to the COVID-19 pandemic that everyone is so tired of hearing about, however, it is the here and now. It is so important that everyone, is covered with some type of health insurance. So that's what my job primarily is to either sign people up for people that don't have insurance and or for people that have insurance, but maybe aren't happy with the plan that they're currently in, to help them, look at other options. So it is a New York State Department of Health application that we do over the phone. It's, very time sensitive with, the 15th of the cutoff to be effective for the following month, first day coverage. And, for a lot of people that, I try to help, it really takes the burden off of them and puts it on, myself in order to facilitate them through and get them the help that they need for them to lead a healthy, lifestyle. We did in the chat, if you will see, we also have a really nice resource that is been launched recently through Blue Cross Blue Shield of Western New York called Bertha. And that is a tremendous link with tons of knowledge and very, very user-friendly for different services. Not just with, health stuff, but, housing and all kinds of things in all different areas, which is a very useful tool if you, want to take a look at that. Again, we do cover the government lines of business, the Medicaid program. Of course, a lot of people unfortunately have left their jobs or maybe have decreased hours, which now makes them eligible. So even if they're employed and maybe had employee-based insurance, and it's not as easy to afford, this is where, again, we can come in and try to save you some money and, give you the best options out there available. So that's pretty much it from what we do. So if anyone has any questions at the end, like you said, feel free to ask.
Awesome. Thank you, guys. So we have about 25 minutes left. I think what we're going to do is we're going to do some breakout rooms, and people can choose their breakout rooms. Let's see here. I'm going to try and have a set of presenters in each room. If anyone has any burning questions, they can feel free to ask now before we go into the rooms. All right, I have Heart, Love, and Soul in room 1, Horizon in room 2, Pride Center in room 3, Blue Cross Blue Shield in room 4. I will open up the rooms. If you want to jump to another room, you should have the ability to do so on the bottom by clicking Breakout Rooms and choosing the room you want to go to. 5 minutes to the top of the hour, we'll reconvene and close it out. All right. There's no other questions. Thanks for everyone who attended and presented and provided their information. I'll collect everything from the chat and put it on our website. Again, if you want to connect with us, Niagara Pride on Facebook group, niagarapride.org, or you can always email info@niagarapride.org. And that concludes today's Lunch and Learn. Thank you, everyone.